Hi, my name is Kevin Croft. I graduated from Stony Brook, the dental anesthesia program at Stony Brook at 2012. Incidentally, I also went to dental school at Stony Brook, graduated there previous to my entry into residency. My private practice, or I guess my practice activities, are primarily in the state of Utah, but I'm also licensed and do work in Virginia, Alaska, and Nevada as well. I do teach. I spend time doing a lot of kind of local continuing education events. I've lectured for a number of regional American Dental Association events. I've also done a lot for the Academy of General Dentistry, and then also kind of regional study clubs that people put on. They'll have me come in and lecture. Most of my practice is as a standalone provider, although I do work again sometimes in group practices, but most of it is mobile in the dental office. How well do you feel the SBDA program? Okay. I feel like Stony Brook was actually a really good choice of residencies for me. It was definitely among the top choices there. So if you can get in at Stony Brook, you're going to be doing well. The reason for that is because it's very there's a good mixture of all kinds of anesthesia. You get a lot of hospital training, but it doesn't supersede the training in the dental office. And then in the dental office, there's not one kind of approach that's taught, but there's a wide variety of techniques and approaches. It's a lot less of a get really good at one technique and do that over and over, and more of a this is how you be an anesthesiologist in all settings for all patients. So it's a very good training. The attendings have different approaches, but they're very much aligned in scope and end goals. And so you do get a very good breadth of training. You get a lot of a wide knowledge base that you can take with you and use in whatever setting that you need, whether that is if you go into academia, if you go into a private practice setting, if you need to hit the ground running in a group practice with high volume or however you practice. I feel like Stony Brook really was quite a good mixture of all of those things, and kind of prepares you, to again hit the ground running wherever you end up. One of the things I've really enjoyed about Stony Brook is the collaboration between the physician training and the dentist training. And what I mean by that is a lot of programs you kind of have to get around the fact that we're dentists and we're being trained in kind of a physician setting. And I didn't feel like that was the case very much at Stony Brook. I felt like there was a lot of mutual respect, that the dental residents were treated with equal responsibilities and very high expectations. And so by the time I finished residency, it was very clear that I wasn't some second-rate anesthesia provider, but I was trained on the level, at the highest level possible. And that was something that was really important to me going into residency, because, and also it's helped me after the fact in kind of the private setting and going forward professionally, because I can sit on council with other anesthesia providers of other backgrounds and training and realize that I don't need to ask their permission, or that they're not more knowledgeable in areas than I am, but we're simply two cohorts with different backgrounds and training, both trained at the highest level and both with equal validity in our views and how to write laws and what kind of policies to implement and things like that. That was definitely something Stony Brook provided for me. The off-service, or the, let's see, the off-service training program, the way that it's set up is actually a really good rotation schedule. And the reason is that you get into one of the off-service rotations and then you gain your knowledge and it challenges you, and then you go back into the clinical setting and you apply that and it makes it real, and then you go out to another one and then the same process happens over and over. And the way that it really is beneficial is that, again, you get a really wide knowledge base on what goes into providing anesthesia in all the different settings on all kinds of different patients, whether there's a consideration for a cardiology patient, or whether you're figuring out what kind of preoperative evaluations are necessary, when lab work is necessary or not. Those kinds of things really get driven home because you do get the perspective of all these different settings, and then you bring it into the clinic, and then it really does create a complete picture about what anesthesia is in general, and it's really nice. And last, I have spent a fair amount of time talking with my colleagues around the nation in different kind of training programs, and each program has its pros and cons. I've noticed that there's some programs that really do train to kind of a perspective of get very good at doing one thing and then go out and do that in practice and be successful. And that is a fine way of doing things. It's actually quite beneficial for a lot of people. They do very well professionally. Um, and there's other programs that are very heavily hospital based, but not a lot of office based. And then there's other programs that are very office based and not very hospital based, or not as much as other programs. And I really do feel like Stony Brook was a perfect mix of all the different approaches, where you really can get out and say, this is how I want to do anesthesia in these settings, and you're very good at it, but you also have the ability to relate to people who do it a different way, or in different settings, or on different kinds of patients and things like that. So I'm very happy with my training at Stony Brook, and I couldn't recommend it higher. Hopefully that you get in there and it ends up being as good for you as it was for me. It's definitely a program where, like Dr. Epstein always says, that you should be jealous of the people who are trained behind you, because the program's getting better and better. And as I understand it, that's how things are. So as great of an experience as I had, as challenging as it was, and as much of a good doctor as it's made me, I hope it makes you even better.